Hello everyone, we will stand up for you today and we will give you a glimpse at what we will address with the MediTwin project. And so it's really our pleasure with Cecile to introduce you to this new project that we are just launching right now. And it's really a collective effort and it's a collective ambition, so the collectivity of this project is really important aspect because we recognize that the interactions that are required to provide a good care to a specific patient have become very complex. And we want to start first by understanding what is at the core of the health of an individual, to be able to represent it in a virtual twin, and also to bring all the stakeholders of the ecosystem of care together to provide an harmonized solution. So we say, with this MediTwin project, we want to provide medical excellence to all patients. And what is excellence is to provide a coordinated care to harmonize the integrity of the physiological system of a patient. So we recognize through the efforts that have been done in the Living Health project, for instance, that the living is very important. Living is about rhythms, it's about interactions at different scales. So to create a heartbeat, we need to have contraction and relaxation of the muscles that also take into account the flux of the ions across transmembrane, for instance, and the cycle of the cells themselves, the replication of the DNA, the repair of the DNA, everything coming together for this heartbeat. And this is not just about an organ, this is about connecting together all the systems in a very comprehensive way so that we can understand all the important aspects that can lead to diseases and then acting on them, providing coordinated actions. There is no one-size-fits-all. We need to go for personalized care, and there is no simple tasks for care of a patient. It's a coordination of lots of efforts for diagnostics with different devices, with, of course, different interventions, drugs, surgery, radiation therapies, and, of course, the different moment of the care, at home, at hospitals, etc., rehabilitations. So we want to provide this integrated view of the patient and coordinate all the actions around him. And today what we see is more that we have a siloed approach of new information. For instance, in a patient profile, when we get a new imaging technology, we add it to the previous one, but how do we really combine them together? How do we integrate the new knowledge from a new information? When we have a new drug, for instance, it takes years then to understand how it is best used, how it is combined with, for oncology, for instance, radiation therapy, surgery. So it currently needs a lot of efforts to understand at what time, for what patient, in what context, with all the different other aspects of the care, will provide most value to the global healthcare system. And we also recognize that today, in a specialized care, we have siloed practitioners that are very specialized in their field, but it's very hard for them to communicate, to take a look at the patient holistically. So we have, of course, the solution that we want to provide to the care teams. It's the virtual twin of human. So I will hand to Cecile to explain a bit what we hear about that.
Okay, so you've seen that. We said that the virtual human twin is a system, but it's also multidiscipline and multiscale. Obviously, a patient can be suffering from several diseases, but also the diseases are strongly intertwined and affect one another. As for an example, if you take a cancer patient that well, he will have an infection, well, you will treat it with antibiotics. But the antibiotics will affect the gut microbiota, and then it will reduce the efficacy of the immune checkpoint inhibitors, and then you'll have, yes, less efficacy for the treatment. And this efficacy have been also shown at the population level through clinical trials, for example. So globally, this is system of system approach. But if we are going further for the virtual twin of human, we also need to start from the real data, the data that comes from the patient in his patient pathway, in his care journey, that will be, well, collected in the hospital with imaging signals such as ECGs, EEGs, biology as well. But we also need to gather something also important, which is the know-how, the reason, the intention why we took this data specifically. And so this is what we want to be able to integrate in the virtual twin of human, and this is also what we want to do in the MediTwin project. So the MediTwin project is a consortium of 14 founding members, which is supported by the France 2030 program. And we will have 7 medical experience across 3 therapeutic areas: cardiology, oncology, and neurology.
So yeah, we are introducing this very transformative project, transformative for the medical practice, transformative for all the partners of the consortium, and we expect to transform the whole ecosystem and to add more partners progressively. We are partnering with EHU, so Institute, University Hospitals and Hospital Centers across France that are each specialized in their medical practice, and they came with medical needs, use cases that we will solve by developing specific experiences, virtual human technologies, to answer the medical needs. We will be supported in developing those technologies by INRIA, which involves more than 10 different teams across France. So it's a really large effort to provide these experiences. Those experiences will not be only delivered on the market by Dassault Systèmes, we will also be delivering through 4 startups, so 4 brilliant startups that will develop experiences, each in different indications. So this is the introduction of the partners of the consortium.
Okay. So I told you that we will have 7 medical experience across 3 different therapeutic areas. So I'll try to give you a short insight of each of them. So we have 3 use cases in cardiovascular diseases, 2 on cancer, and 2 on neurological disorders. So the first use case is that we are interested in, which is led by the IHU Institut Imagine, is about a specific congenital heart disease that can be palliated by a series of 3 surgeries. This disease is called hypoplastic left heart syndrome, or HLHS in short, is still lethal across the surgeries. And so what we aim in doing that is to be able to, with the clinical team, find insight of what will happen to the patient so that we can prevent the worst. The second is with the startup INERT and IHU Lyric about the prevention of sudden death after a first myocardial infarction. The third one is with ICANN and CHU de Nantes about how we can link the vascular system and the microbiota system, so that in the case of atherosclerosis, we can help the patient have a better view of what is happening to him and also help him prevent what will happen with this specific disease.
I will introduce you the cancer, the specialized applications for oncology. So we will do this effort with the IHU Prism and IHU Strasbourg. We will develop virtual twins for two purposes and to connect them together at the end of the day. Very importantly, what we need to understand to treat a specific patient is to what extent is a disease and what is the risk of progression of this cancer disease in lymph nodes and in different organs. And once we have understood what is the staging, what is the dissemination of this cancer and the risk of evolution through time, we will be able to take better decisions for specific patients. For instance, undertaking for liver metastasis specific treatments, local treatments added to chemotherapy or systemic treatments. And based on what has been presented, introduced by Julien Vibert earlier, we also need to understand what are the best treatment approach tailored for this specific patient. So we will combine all the biological data that we get on specific cancer through genomics, through histology, through all the different biomarkers that we will assess and combine them together to support the precision medicine for a specific patient. So combining those together, we will be able to support the best decision pathways for patients treated for a cancer.
And for the neurological areas, we have two use cases. So I will invite you to assist to the session tomorrow, which will be more on the, for ICM, Institut du cerveau et de la moelle épinière, about the Alzheimer's
and IHU Foresight.
And IHU Foresight, yes. So for the first one, it is about supporting the early diagnosis of Alzheimer's diseases. And I will not talk more about it because you will hear about it tomorrow. The second neurology experience is addressed about epileptic patient and the patient journey from childhood to adulthood. So epilepsy is detected at a young age, and it demands some specific treatment, some adjustment to be able to find the right treatment. And after, it becomes even more complicated when the patient goes from childhood to adulthood through puberty. And the complexity is not only about the biological changes that will happen inside the body, but also how a child will be treated and how an adult will be treated given all his care pathway. So this work is done with, in collaboration with Institut Imagine and Institut du cerveau et de la moelle épinière. And so the building of this virtual twin is based on a practitioner platform which will connect all actors and help for the collaboration of all the care networks, and is also based on, as I said before, a multiscale, multisystem, modeling in this case, which is based on real medical and health data. And so this virtual twin will be used to reproduce the health condition of a patient and to be able to help to diagnose, treat, and prevent diseases. And I insist, so that it can be accessible to the whole collaboration network centered around the patient.
Maybe I can insist on the fact that tomorrow you also will have a dedicated introduction about the multiscale, multisystem approach. So it's the very last presentation of the day 2, so please stay until the end to assist to this very important presentation. And as I said, it's a collective effort, it's a collective ambition, and we want to invite the whole ecosystem into this ambition to join the effort. So we are started with 14 members of this consortium, but we will create networks, create links with all the ecosystem. We will need to connect, for instance, as we said previously, to advocate in the Agency of Innovation of Health, for instance, to get the support for regulation, for financing those innovations, to make sure that at the end of the day, they will be accessible to all the patients across countries. So we don't want to provide excellence to a very limited number of patients. We really want to provide medical excellence to all patients. And it will just be done, as you very, very well mentioned, that with advocacy and expanding the networks. We also know that we are starting with a very limited number of medical acts. There will be proof points that it's possible to change, to transform the field, and we will be very interested to develop other therapeutic areas, other medical acts through the years to come. And with that, I would also mention that we were speaking a lot about focusing on treating patients, but it's very important that treating a patient is done in collaboration with the patients. More and more, we see patients being actors of their care and being empowered to be in a very close relationship with the care team and being a member of the care team. So it will also involve patients groups, and we will work very closely with them to develop experiences, representation, as we said, that are meaningful to the patient and that will support not only the communication, but their involvement in the care. It will be supported, those experiences will support also the education, the training of not only the patient, but also the fellows and the physicians. And it will be very important also to regularly to communicate and to share with large networks of physicians to get the support and to understand how those new technologies are handled in different types of practices across the world. I think we have a short video to give you a glimpse to what it can be used. And with that, I will launch the video.